Take a look at these products. Do any of them look familiar? Perhaps some of them are in your home right now. Would it surprise you to learn that every one of these products has been recalled? Nursery products contribute to an average of 163 infant deaths nationwide every year. So what is a product recall? It's when the government and the manufacturer remove a product from the market because it's dangerous and poses a risk of serious harm like choking, drowning, strangulation, or even death. Children's products are recalled more frequently than you realize. On average, over 100 children's products are recalled each year. Chances are you have a recalled product, which is why it's so important to check. Even if the product is removed from the store shelves, very few steps are taken to remove the product from homes, childcare facilities, secondhand stores, and garage sales. That means that millions of recalled products are still in use, which is why you should always check with saferproducts.gov or the CPSC website to make sure the products you're using have not been recalled. Hello, I'm Dr. Tammy Button, and I'm joined today by 3 local pediatricians to discuss infant safety and product recalls. With us today are Drs. Glos, Dr. Salazar, and Dr. Walker. Thank you so much for being here today. In your experience, are parents aware of recalled products?
No, in my experience as a pediatrician, I'll see parents using, or they'll tell me what they're using in the home and in what ways they're using it in the home, and they're wholly unaware that these products have been recalled. And as a mom as well, I've used recalled products before I realized, oh no, that was recalled.
Yes. I see a product over here in this room that's been recalled that we used as well. So as parents, I can say firsthand too, I didn't always know.
Yeah.
No, it's very important to create this awareness because there are intrinsic factors for sudden infant death and extrinsic factors. We cannot control the intrinsic factors that are factors that are just belong just to the baby, like being preterm or have any other genetic issues or family issues, but there are things that we can definitely do to help them. And one of those is actually control the environment. And part of that is to help the parents to be aware to check for any safety recall. And even if a family member tells you, oh, my child did really good, nothing bad happened, if this has been recalled, there is a reason. There's a safety precaution that we need to take care of so we can prevent a sudden infant death in our kids.
Absolutely. Dr. Walker?
Yes, so in my experience, most parents don't know about recalls. And so we like to tell them, I know that there's a lot going on and I'm adding something else to your list, but for the products that you have in your home where you're putting the baby to sleep, where you're sitting the baby for, rest or relaxation, check those products. Just look up that product and see if there's a recall.
That's great advice to add. And also recognizing that you're adding that to also an already long list of things that you have to do with a baby.
Absolutely.
So what about in your practices, can you share some examples of things that have unfortunately happened because of using products that have been recalled?
So I don't have any accidents from recalled products. I do have unfortunate outcomes in terms of like walkers. I have kids that'll come in with tight heel cords. They won't put their feet flat on the floor because they're in the walkers. And in order to make a walker go, you have to be on your toes to make it roll around the floor. And so the babies don't learn to put their feet flat. And sometimes they'll become, constricted this way. So I always advise, please don't purchase a walker. If someone gave you a walker, return the walker. The little softer things are fine, but I really don't like walkers. The American Academy of Pediatrics has put out a statement against walkers.
Yeah.
But that's just an example of something that people think is, oh, this is great, but it's not actually good for the baby.
Yes.
So in my case, unfortunately, I had parents that come for me to check the baby because the baby fell. And most of the situations have been that the mom is feeding or the dad. I had both different cases, but mom is feeding and then suddenly she starts falling asleep and the baby just slides and fall. And then of course, like the baby starts crying and wake up mom. But that could be very dangerous because when a baby fall, and mostly if it's just a newborn, they are more sensitive to have like a hemorrhage or have any other
Oh,
complications.
yes,
So
yes.
making parents aware that if they are extremely tired or fatigued, be careful. We actually don't recommend that if they are too tired to feed the baby sitting in a feeding chair. So those kind of precautions are very important to prevent this kind of accidents.
Yeah.
Absolutely. To make a note on the walker conversation, I will say that the pediatric physical therapy folks also recommend against the walkers because it doesn't put the kids in the proper positioning to go through the gross motor skills appropriately, and it does delay walking ultimately as well as other gross motor skills. And then the other thing about walkers too, in addition to the tight Achilles tendon heel cords, is you're giving mobility to a human that should not have mobility yet. So I have actually seen a very bad burn case from a child ramming into a kitchen table that had a hot cup of ramen noodles on it in a walker. And so to comment on the walker, do not give it to somebody else that can give it to somebody. Take it somewhere where it can be properly disposed of and taken out of rotation. As far as recalled products, I have seen in a case of an accidental suffocation from use of a boppy in a sleep space, a boppy pillow. And as a parent who bottle fed one baby and breastfed another, I do like the boppy pillow when you're observing. As somebody else who likes to give parents good activities and stuff, the boppy is great for elevated tummy time while you're sitting there with the child. But
Yes.
if you walk away from the child needs to be put back into a safe environment on their back. And so using products that are maybe not even recalled, like you were saying with the walkers, appropriately when the infant is observed versus unobserved. And observed being like you're interacting with them, you're not sitting there on your phone and scrolling through things and watching TV and distracted. Because I know I'm guilty of distracted parenting. I think we all are with today's
Yes.
technology. And I think
Oh,
that's
absolutely.
that's how we get access to most of these products, right? Like the DockATot, super popular on social media. That, if you ask me, my least favorite thing, I will, if I see it on somebody's baby registry, I will say, take that off, please. Get it out of your baby registry. Here's why. And it's just these manufacturers target our vulnerability as parents, and this is the best product to be the best parent, and that's all we're ultimately trying to do, right? We're trying to just raise our kids the best way that we possibly can, but knowing what your good sources are for this information and how to use these products is ultimately the bottom line, right?
Absolutely. And marketing is the key with a lot of this, targeting parents who think, okay, if I just have this, it's going to get better. It's been easier. And so you bring up a good point about just being aware of the things that have been recalled. And thank you for sharing those things that you have observed in your practice. You bring up a good point too about adult supervision. How does supervision play a role in this with different products and making sure that things are safe at home?
Depending on the age of the baby, their milestones, there's different aspects and different areas where adult supervision is critical. So if we go back to the safe sleep, for example, they should always sleep on their back and with nothing on the side, but we highly recommend tummy time. Tummy time is super important, but tummy time has to be supervised. Tummy time is necessary to help with the motor skills and preventing misshapen of the head, the neck, torticollis, which actually can create problems later on, but
Yeah.
this has to be always supervised. Other important keys where supervision is needed is like when you're changing your baby in the changing table. You want to have everything ready. You don't want to say, "Oh, I forgot the diaper," and I turn around, the baby's
Oh,
on the table, and then
yes.
suddenly the baby's on the
Yes.
ground.
Yeah.
1 second is what it takes, and is what I tell parents. 1 second,
Yep.
and then you have an accident. So having everything ready is key. And of course, like later on when the baby is starting to explore, because this is part of their development and milestones, we want to be careful with any surrounding small objects. For me, like 6 months, they are already reaching out, trying to put everything on their mouth. So when they are able to reach out, I always say that area has to be free of clutter. Nothing like little batteries, little safety pins,
Yes.
or anything that they can actually put on their mouth, or like they can swallow, those little things. So those are key. And of course, there's like, depending on their milestones and ages, there's a lot more to talk, but I'm going to let my colleagues to expand on those.
So I think with the adult supervision, the best thing is to create consistency and routines. So even before the baby arrives, as far as being prepared for diaper changes and all that, you should kind of just think of how you set up the space of where the baby's going to be. What
Yes.
and do run throughs. Okay, if I'm going to change a diaper, can I reach the wipes? Can I reach the diaper? Can I reach everything that I need without having to leave the side of the changing table?
Great
Just
advice.
those type of practical things. Also, research your products that you have, what things you have that you're going to use. And then once the baby arrives, I tell parents all the time, put the baby where you want them to be. So let the baby get used to being in the bassinet. Let the baby get used to the feel of the pack and play. Because if you don't do these things, they won't feel comfortable in the environment. And you need to know how you need to set up your routine so that it flows. If there's consistency, you're calmer, the baby's calmer. So you're already sleep deprived. You don't want to be frantic. And then
Yes,
that leads
absolutely.
to more accidents and, things that could happen.
And I usually tell the families, for example, initially when you go home, there's usually a lot of visitors. And they're going to want to be holding the baby. When the baby falls asleep, again, back to the routine, have that time of, hey, it's time for us to get in our bassinet, have that routine and be firm with it. It's your family and your lifestyle. And when everybody disappears in 2 weeks, you're the one stuck with trying to get this child to lay down in their safe sleep environment. I hear that a lot from parents that their child doesn't like the bassinet. They don't know what they like, but I understand what they're saying. The child doesn't want to be put down because they're not used to it yet. It takes time, and it's to your advantage to start out right off the bat with those routines and those and being consistent with it, like you said.
Definitely. And are there any products that you think give parents a false sense of security?
Yes, I consider that those like alarms can actually be a false sense of security. There has been no proof that the American Academy of Pediatrics actually recommends that those are not actually really precautions for a sudden infant death, because in reality, what happened is that those alarms, either they could create anxiety or this false sense of security, but they won't really prevent an accident. So the key is to actually share a room, but not share the bed. Have the baby in the same room. At least for the first 6 months, you can have the bassinet in the same, like next to the bed. And that way you make sure that baby is okay. And of course, having all these other precautions. Avoid also using like crib bumpers, because crib bumpers can be actually something that gives you, oh, he won't bump his head or something, but actually they could suffocate if the baby rolls over and is sleeping. So that those actually are things that we have to be cautious with. And also like the bars to prevent the baby from coming out of the crib. So that those are actually things that we have to make sure that they are properly, and based on the consumer's website, make sure that they are properly aligned so they don't allow actually an accident, baby getting stuck or things like that. So those are important things that we think that they could give us safety, but probably they could also create an accident.
Yes.
I would add, even the baby monitors might give you a false sense of security. Um, a baby monitor is never a substitute for putting your eyes actually on the baby.
Yes.
So
Yes.
they're great, and I think everyone should have them. But you should always, periodically go in and actually physically look at the baby, because you just can't rely solely on that. I don't think there should be extended periods of times where you're like, oh, I didn't see the baby for several hours. So a baby monitor could give a false sense of security.
Thank you. Another really good point to remember. And you've all touched on a couple of references, the Academy of Pediatrics, websites for consumer safety. What are the references that you give to parents so that they have something that is, let's say, approved or are the ones that are actually setting the standards? Because we all know you can find any reference you want these days. And so it's important that parents have a respected reference.
Yeah, so my go-to website is the American Academy of Pediatrics website for parents. It's healthychildren.org.
Great
They have
resource.
excellent safety information and product information on there, and they update it regularly. There's stuff about car seat safety in there, sleep safety, why we do these things and why we recommend them. I feel like it's really important. You know, there's a lot of people throwing information at you when you're a new parent, and it's important to know why. Have that extra layer of why. It helps the family feel more confident in the decisions that they're making for their children and their family. And so the healthychildren.org has excellent information on it. It also has it will send out periodic emails with updates on recalled products. And so I think that that's my number one go-to.
Great.
Same for me. I really like the healthychildrens.org because it's actually something based on the American Academy of Pediatrics target to parents. So it's very easy to understand and actually has a lot of great information and great resources, not only on this topic, but in a variety of topics. Something else too about the consumer product safety. Another website I like is the Consumer Report, because there too we can actually see like really accurate reviews of the safety of the products, and actually that can help us to make a more conscious buying and make sure that what we are buying is safe and is approved at the same time. So those are like little other keys.
So I'm going to do the opposite. I don't give a lot of sites for people to reference. I do have some handouts, anticipatory guidance of things you should think of and, you know, things to be aware of. But I also like to warn parents to not become Google Docs.
Oh, yeah.
And start creating different ways of providing nutrition or different ways of sleeping patterns. And you can find anything on the
Oh, you
internet,
sure
and
can.
everything is not
Yes.
safe. So
Yep.
I advise them that if you do see something that is non-traditional or maybe a little different, please talk to me first so we can have a
That's
discussion about it.
fantastic.
Because you would be amazed at some of the things that people are like, oh, I heard this and it sounds like a great idea. And I'm like, no, don't do that.
Yes, absolutely.
Yeah. What about all of the ways that you can buy gently used or never been used products on social media, through different online websites, getting them from family members, stopping at a garage sale, whatever you want to call it? What do you caution patients about those ways of getting products?
So I generally caution to check the age of the product. As Dr. Salazar said earlier, if it's over 10 years old, it's very likely that it's not safe to be using. And then also check those reputable websites to see if these things are in fact recalled, and let them know. Sometimes people are good intentioned and they don't mean to be selling you a recalled product, and they just don't know. They
Right.
used it, their child turned out fine, as they will tell you. So what's the big deal? Well, the big deal is something happened from a safety standpoint to somebody else's child. That's the big deal. And the big deal is that, just as Dr. Salazar said earlier, we have so many things that we can control and so many things that we can't. So let's get the good information out there and in the hands of these consumers and these parents who do truly want what is best for their family and for their child.
So many times We want to save a few dollars, but this actually can cost us a lot more. We have to outweigh this. And that's why it's very important that we do our research. And of course, if it's at the garage sale, you can check in your phone, like making sure that this is safe. But if not, if we're searching online, first make sure this is actually has safe, it hasn't been recalled, because as I said, we want to outweigh the cost. How much more is going to be for us losing our baby to something that wasn't safe? So those are the type of precautions we want to take. And of course, nowadays everything is available. And as Dr. Glos said, they don't have bad intentions when they are selling these products.
No.
But we have to be cautious because we need to really think about the future of our child.
I would add the one thing that I would not purchase at a garage sale or over social media gently used would be a car seat.
Absolutely.
Good point.
yeah,
Yes.
Absolutely.
I don't know if people are aware, but if ever a car is in an accident, that car seat is supposed to be disposed of. A lot of people don't know that. Some will continue to use it, and that car seat might be one that they decide later, okay, my baby's outgrown it, and now I'm going to sell it, and it should never be in rotation at all. So you don't know the history of a car seat that you're buying over social media or at a garage sale. So I would not purchase a car seat.
And there are great places in different areas of the country that will help you replace that car seat at no cost for you. So we have our own resources here in LaPorte County. But when I
Yes.
was in Iowa, there were resources, and it's different depending on where you're at. So just call your doctor's office and ask them. Somebody there will know what your resources are.
Exactly.
We don't want to make you were in a car accident. That's scary. You came out of it, your car seat looks okay. But the reality is the car seats are safety tested one time. They're not safety tested
Mhm.
after a fender bender or a side crash on the opposite side of where the car seat is. And that's the big reason, again, adding that layer of why is it not safe? It looks fine. That is why, because they're not safety tested subsequently. And we want you as the parents to have the safest products for your children.
Yeah. And even you had mentioned earlier too about timeline with things. How long if a product, hasn't been used for 5 years? When we think about siblings, those 5 years go quickly. So even car seats are different objects that we used with one child that now are no longer valid for the next child. And so it's always important to keep that in mind. So let's transition to home safety in general for infants and toddlers. What are some of the biggest things that you recommend parents have as far as detectors, alarms, things in the home, not for the baby, but just for home safety in general when you're talking with new parents or expectant parents?
So, in addition to your smoke alarms and carbon monoxide detectors, um, I tell parents that they should have alarms on the doors, especially
Oh,
for the
yeah.
toddlers. They're pretty crafty.
Oh, they are.
So
Yes.
you need to know if a door is opening that you didn't open. So it's always nice to have something else that you can hear. Locks on cabinets, all of those things that they can grab that could cause, some type of harm.
And again, it's a lot of stuff. There's a lot of information.
Yeah.
We're always happy to do prenatal visits with parents and run through a checklist. And then not only again are we, going through it from a physician standpoint, but me as a parent now, I'm seeing how crafty and just straight up shady my kids have been. And they're again very good at getting into trouble. And so I've learned more things that I add to my anticipatory guidance when I talk to these families.
Dr. Salazar, did you want to add anything?
Also, one recommendation is to be very careful that we don't have any like loose objects like a hair dryer close to the area where we're giving a bath to the baby, like little things, little accidents. So the cords actually are something that are very dangerous. Actually, going back to the crib, we want to be very careful that there's no loose cords there. Sometimes we have hanging toys. Those actually can be dangerous. It is also recommended to use a pacifier to sleep But at the same time, we want to make sure that the American Academy of Pediatrics does not recommend that the pacifier when the baby is sleeping is attached to the cloth, because actually that creates some sort of tension, and that could be dangerous as well. So those little things. But going back to a little bit older kids, we want to be very cautious with medications. They have to be out of reach for little ones. We want to be very cautious at the kitchen with liquids that are used for, I mean, liquids that we use for other purposes that could actually, a toddler can reach, can open and can drink. Those actually create a lot of accidents, intoxications. Unfortunately, I've seen those type of situations, and many times they lead to many complications. So those type of precautions are very important, because we want to make sure that our environment is safe for our toddlers as they progress basically on their development, exploration. And that's where like having those precautions, but also the adult supervision is key. And of course,
Yes.
we probably haven't mentioned much about it too, but animals too. So we want to be careful as well. Don't leave our little toddler with a dog unsupervised. That unfortunately I've seen serious accidents of bites, and like with a lot of complications for babies.
Yes. And something else to think about having in the home is firearms. I think a lot of people have guns and weapons in their home, and making sure that we have those in a safe place that is not accessible. I have had a gunshot wound, and the child, it was toddler aged. The gun was left in a pocket, and it shot across a room of children and missed everybody except for his hand, that child's hand. And that made the hair on the back of my neck stand up, how close that was to being just a catastrophic accident.
Yeah.
So making sure that guns, the safeties are on, they are not left out if you take a gun out to clean it. It's important to show the children, hey, this is dangerous. Talk about safety. Talk about how dangerous those things can be. And talk about, when you're this old, we can talk more about it, or we can do the shooting range at this age. They do have gun safety classes for older children. The AAP recommends that all firearms in the home should be stored in a locked safe separate from the ammunition and unloaded. And so just being aware of those recommendations and being conscientious about it, because I think that a lot of people do have firearms in their homes for self-protection or for recreation.
Yes, and firearms, no matter what side of the argument you are for firearms, pro or against, we can all
Yeah.
agree that child safety is ultimate. That is a goal that we all strive for.
Absolutely.
So, what do you recommend for parents too when children, or even looking for a babysitter, that it may be in a home or going to somebody else's home? Do you have recommendations on how to talk about if there are firearms and ask questions to verify that they're safely stored?
I encourage parents from day one that this is your child, and there's no such thing as being too um, aggressive in making sure that they are safe. So it starts with, we talked about earlier, there's lots of visitors for a newborn and everybody wants to hold the baby and kiss the baby. No, we're not going to do that because there are a lot of germs. So I would ask that everyone be respectful, that we're all going to wash our hands. And if you have a cold, please don't visit us right now. And so we continue on to
Yeah.
when we get to who's going to babysit or care for my child. You have a checklist of questions. And if they don't have the answers that fit your style of parenting or the environment that you feel you want for your child, then that should be someone that's not a candidate to
Excellent.
babysit. Because what they have in their home, that's their home, but you don't have to leave your child there. The other thing that I try to encourage people as far as firearms is that, of course, follow the recommendations that it's in a lockbox, the ammunition is separate. But if you have firearms and this is a regular part of your life, then I encourage them not to have toy guns in the house,
Absolutely.
because it's hard for a
Good
kid to
point.
differentiate
Yes.
playing versus this is the actual thing.
Yes.
So if we're going to have firearms, then we're not going to have toys that look like firearms because that gives the kid a confusing picture.
If we are picky on other aspects of our life, why wouldn't we be picky about who is going to help us taking care of our child?
Yes.
Of course, nobody ever will do a better job than ourselves. But many times we have responsibilities. We have to go to work. We have to do other activities. So we want to make sure that we do our research. I mean, you don't have to be rude to actually ask the person like that. All these safety cautions have to be taken care of.
Yeah.
But you want to make sure that you are basically that your child is in a safe environment.
And I always tell the families too, you are the voice for your child. You are the advocate for your child in every aspect. When they come in to see me and we're making a medical plan together versus picking somebody to help them take care of their child, you are their advocate, and that is your job. And nobody should make you feel bad for doing that job.
Definitely. And if they do, then maybe they're not part of your team.
Exactly.
Yeah.
It takes a village to raise kids, and we get to form that village.
So are there any certifications or classes, prenatal classes that you recommend parents, caregivers take while they're getting ready for becoming parents or are new parents?
Yeah. So the hospitals that you're birthing your child at generally offer, infant classes and teach you how to change a diaper, how to swaddle a baby, how to breastfeed, how to bottle feed. But I think one of the more powerful classes that we can all take when you have children in your life, whether they're your own or somebody else's, is actually a CPR class. Take an infant CPR class.
Yeah.
It is offered free in Porte County for our families. And even if you only know how to do hands-only CPR, you can really make a difference and give yourself so much more confidence in your parenting and confidence in the people around you. So
Definitely.
So I 100% agree with Dr. Glos. Learning how to actually do CPR is key, and there's many free resources available. Actually, there's going to be a website that is going to be shared where parents can actually get this type of trainings for free. But it's very important. Many times we face situations where the baby is learning how to eat certain foods,
Yes.
and then they are choking and we don't
Yes.
know what to do.
Yeah.
Those few seconds that can mean death of life for a child. So if we know how to get things started, like we can save a life. So I think that learning this type of trainings is very, very important.
The CPR classes also offer you education on what to look for. Sometimes parents don't know the signs of distress.
Yeah.
Or, if this is like something really bad, and having just that extra bit of education will let you know something has to be done immediately, or calling 911 or actually performing CPR, but you have another layer of education there.
And as was mentioned, when you're teaching a baby how to eat solid foods, and some of the gagging and choking is to be expected, but when do you intervene? What do you do? And just having that confidence as a parent is so important.
And I have heard from some parents, oh, dad did CPR because I don't think I'd ever be able to do it to my own kids. I will tell you, as somebody who's been in that position of having to do infant CPR in a not medical setting, a flip switches in you. Like you will be able to do CPR. You absolutely will.
Absolutely. And sitting here and listening to all of the answers that you provide, I can just see the benefit that parents and your patients have from being with you and learning from you and seeing their children grow. So thank you for taking time away from patients today to be here.
I think we all know in our field of practice as pediatricians that Indiana is in the bottom 5 in our country for infant mortality. And LaPorte County, unfortunately, is in the bottom 5 in our state. And we're really looking to provide education to the families and drive home how to safely care for our smallest, most vulnerable residents. So I think this was an awesome opportunity for us to get together and kind of talk about those things and how we can make a difference.
Yes, unfortunately, in our area and in Laporte County too, we have high rates of preterm births, low birth weight babies, and all these are actually, unfortunately, intrinsic factors that are factors we cannot change anymore. That increase the risk of our babies, but we can change many other things around it. So if we work on that together and we can spread this to the community, we can actually help to prevent this type of accidents or sudden death in our babies.
It was absolutely awesome to be here today to help in any way possible. I would encourage all parents to, follow up on some of the things that we said. But another important part of this is keeping those well child visits. They might seem annoying, like my baby is fine, but there's so many things that are being monitored at each visit, and they're scheduled the way they're scheduled for a specific reason. We're checking growth, we're checking development, we're giving advice on what you should expect and anticipate next, in far as what you should do for safety in the home and what type of things you need to look out for. So don't miss out on that opportunity for education, but also your child needs to be examined at those intervals. So there's a 1 month, there's a 2 month, there's a 4 month, there's a 6 month, there's a 9 month, a 12 month, 18 month. It just keeps going, but don't miss those opportunities. And then after they're toddlers, their annual exam is just as important because we still are monitoring how they're doing in school. Are they meeting their milestones? Physically, what's going on? Is something happening too early? Is something not happening on time as far as puberty? Those type of things. So it's so important to have a primary care physician and for your child for everyone to have their scheduled physicals.
Yes.
And we do our health facilities do have ways to help you get to those. So don't let transportation be a barrier. Please reach out to us because we want to help you get to your appointments and get the care that you and your children need.
I want to thank you for being here and for taking a break away from seeing patients to be here and sharing your wealth of knowledge and encouragement with everybody. Thank you.